Hi, I'm Lance DeLange with Yada Yada. Thank you for joining us. Today we're going to talk about your distal biceps tendon, some potential problems that could occur with it, specifically tendonitis or a potential rupture. The biceps is the muscle here in the front of your arm. There are two tendons that come up into the shoulder area. There is one tendon that comes down and attaches upon the radius. This is what this conversation is for today. We always think of our biceps as a flexion, which it does perform that, but perhaps more importantly, this tendon is known for its ability to supinate, to bring the palm of the hand up. If you're receiving change at the counter, your palm needs to come out. This tendon particularly is involved in that motion. This tendon can commonly be injured and can rupture, or you can have a tendonitis with it. So if you were doing something and felt a pop in your hand, often a searing intense pain, but sometimes simply a pop, it's possible to rupture the tendon, potentially pull its insertion off of the bone, or even a partial tear where the tendon can partially tear. If you've done this, surgical intervention may be required. If you're wondering how can I identify if this is possible for me, there's a couple things you can do at home to check. If you bend your elbow, you should be able to commonly feel that tendon. If you're not sure what you're feeling, of course, check on the other side of your arm. If you can feel a definite tendon with your elbow slightly flexed, with a slight bend to the elbow, with a slight flexion of this muscle, if you can grab and feel a solid structure, but you feel on the opposite side and it's boggy, very tender or swollen and difficult to feel, you may have ruptured that tendon. It is possible to tear that tendon and still have it near the bone. For example, that muscle attaches at the tendon to the bone. Very commonly when it tears, it will pull itself completely off. This becomes easier to diagnose as you would feel for that tendon and it would not be palpably present. However, it's possible to tear it off without much retraction or pulling away from the bone. This could be a little more difficult and might require further imaging such as an X-ray or an MRI scan. So if you're not sure if you hurt your tendon, a couple things you can do: feel for it. If you pull against a little resistance, that's painful, but specifically if you try to supinate or turn your palm up against any resistance. If you're holding someone else's hand or your own hand and resistively turn the palm up and that produces significant discomfort, you may have injured that tendon, and we recommend that you seek medical evaluation and attention. As a ruptured tendon that goes on for an extended period of time can retract, become atrophic or wither away smaller, and scar in, hence potentially leaving the tendon irreparable. So if you feel this may have occurred, it's best to have it medically evaluated by an orthopedic specialist, as surgical intervention may be best performed prior to 2 weeks after the injury. If there was no injury, such as a slip or a fall or pulling or feeling a pop, but you're just simply getting soreness there, perhaps you've been working out at the gym or doing other activities and getting some soreness, it may be just that you have a tendonitis in this area. A tendonitis in this area could respond to simple activities such as an anti-inflammatory, icing it, perhaps heat first to do some stretches, icing it afterwards. There are some stretches in which we will link to below with a physical therapy visit on this diagnosis that could help to calm it down and treat it. But if you continue to have symptoms in spite of resting in these conservative modalities, you may desire to seek medical attention and evaluation to help get proper diagnosis and treatment for this problem. So there is help out there that exists. If you've sustained an injury or if you have pain in this area, please don't ignore it. Seek medical attention, hopefully that you can get it taken care of before it potentially becomes a bigger problem. As always, thank you for joining us and stay safe out there. Have a great day.